My name's Lorna. I'm a nurse practitioner student. What's your name?
James.
Hi, James. It's nice to meet you.
Yeah, you too.
I'm going to be doing an exam on you today. Is that okay?
Yes.
Okay. Normally for this exam I would wear gloves, but for this purpose I won't be wearing gloves today. So we'll be doing a cranial nerve assessment today, and we will start today with cranial nerve 1, which is a familiarity to identify or be able to identify familiar odors. Can you please plug one nostril and close your eyes?
Sure.
Okay. Can you identify this smell? And as you inspire deeply?
Vanilla.
Okay. Alright. And normally you would do this with each nair, 3 different odors to make sure that the patient could identify similar smells. And in this case, olfactory nerve, cranial nerve 1, was intact. The second cranial nerve is the optic nerve. And we're going to first perform a visual acuity. So if you could look at this chart with both eyes, can you read this first line?
Yes. PZENFSA.
Okay, and the second line?
NVQSABC.
And can you cover your right eye? And read the top line?
PZENFSA.
And the second line?
NVQSABC.
And the other side?
PZENFSA. NVQSABC.
Okay, so visual acuity is 20/20 with the Snellen chart and both eyes. And then I'm going to use this light to look into the back of your eyes to visualize the retina. So if you could look straight ahead. Okay. Okay. Alright, so we didn't have any abnormal findings. We see that the disc margins bilaterally are sharp, and we notice that the pupils are equal and reactive to light. So I just want you to now take a look at me. I'm going to test your 4 visual fields. Just tell me how many fingers I'm holding up.
2. 2. 4. 4. 2. 2.
Normally we want to make sure that the patient is looking straight at our nose, okay, but here we see that the patient was able to identify 4 visual fields, so the optic nerve is intact. Now we're going to assess cranial nerves 3, 4, and 6, ocular motor, trochlear, and abducens nerves. So here we're going to I just want to test your extraocular movements, so you're going to look straight at my nose, and just follow my nose with your fingers, do not move your head. Okay, extraocular movements are intact in all 6 cardinal fields, and this is testing convergence. Just follow my fingers. Okay, and convergence is intact. For cranial nerve 5, the trigeminal nerve, we're going to have you describe on 4 different areas of your face where the object feels sharp, dull, or soft, okay? Go ahead and close your eyes.
Soft. 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 Soft.
Okay.
Dull. Dull. Sharp. 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 Sharp.
Okay. Patient was able to identify whether the object was sharp, dull, or soft. So the trigeminal nerve is intact. And I want you to clench your teeth, and I'm just going to feel here. Okay. And then I'm going to test your corneal reflex. Okay. Just look straight ahead, and we're just looking for a blinking sensation when the Q-tip comes close to the eye. Okay. And then now we're going to test cranial nerve 7, which is the facial nerve. We're going to expect the symmetry of the face by having the patient smile, okay, frown, puff out your cheeks, wrinkle your forehead, raise your eyebrows, close your eyes tight, stick your tongue out, move it back and forth. Okay, very good. So cranial nerve 7 is intact, facial is symmetric, and then cranial nerve 8 is the auditory nerve. First I'm going to have you plug one ear, and then I'm gonna whisper in your right ear, and then I want you to tell me what I say, okay?
77.
Okay, go ahead and plug this ear.
55.
Okay, patient passed the whisper test. Now, this is the Weber test, and I'm going to have you tell me if this sounds the same in both ears or different.
That sounds the same.
Sounds the same. Okay. And then the Ryan's test. Tell me, I'm going to start at the back of your ear. Tell me when you can no longer hear it.
No.
Okay. So, same thing.
No. No.
Okay, so we're going to note that there's no conduction loss and the auditory nerve is intact. For cranial nerves 9 and 10, the glossopharyngeal and vagus nerves, we're going to use a tongue depressor to test a gag reflex. First, I'm going to have you swallow. Okay, stick your tongue out. We would say ah, and we would place the tongue depressor in the back. Gag reflex is intact. Okay. And then we also note the uvula and the palate that are symmetrical. Cranial nerve 11 is the spinal accessory nerve. We're going to have you shrug your shoulders, okay? And now put them down, shrug them when I'm okay. And then there's a 5 in strength with full range of motion against gravity. Turn your head to the left, turn your head to the right. And again, full strength 5 with able to have full range of motion with resistance against gravity. And finally, cranial nerve 12 is a hypoglossal nerve. We'll have you open your mouth, okay? Stick your tongue out and move the tongue to the left, the tongue to the right, up and down. And we note that there's no atrophy or deviation. And then I'm going to have you say the words L, or the letters L, T, and N.
L, T, N.
Okay. That concludes our cranial nerve assessment. Thank you.